Park and recreation professionals and their agencies are essential parts of the public health system, offering programs and services that have broad impact on community health and well-being. By serving as community nutrition hubs, park and recreation professionals connect all members of the community to services and supports that address food security, nutrition literacy, and social connection.
I think community nutrition hubs are really critical for communities, all communities, but particularly underserved communities. And I think this program provides a structured place, but also education and resources.
Well, some of our programs and the research shows basically that when people learn more about nutrition and have regular intervals of being in contact with people to talk about nutrition, it can help change their behavior around nutrition and even physical activity.
And making sure that your after-school summer camp programs are instilling those conversations are helping to mold productive members of society.
It's a safe space. It's a safe for our feelings, safe for our emotions, a safe place for anyone in our community to come. And we need safety more than anything right now. And I know with education, if there isn't safety, there's no learning.
One of the ways we've been able to leverage the Technology Center on the campus through our nutrition program development is by providing a space where people can have dedicated access to SNAP and WIC enrollment websites.
It's really important to tell people all about them and to really convince them that it's not as hard as they think to apply and to get those foods. And we try to explain to people that, yeah, they're there for the taking, that's what they're for, and they really are important in food access.
With food assistance or food nutrition services or SNAP, we made it easier for people to apply. You could apply online. You didn't have to have a pin signature on things. And so just different things have made the doors open wider and reduced the barriers to be able to have access to resources. And that's what I hope and have seen, so that, you know, those that are qualified for benefits, they can get those benefits.
We provide free health screenings and nutrition counseling and connections to local resources.
We've been coming here to the Sorensen Unity Center since 2018, offering, again, free screenings for chronic disease. And part of what can lead people to get chronic disease is not eating healthy or eating the wrong foods.
Those health screenings can really give people an idea of where they're at currently in their health, where they can then make small changes within their diet or other lifestyle habits that can help them improve their health.
One time I came in and did some taxes here. Then I met up with the wellness buzz. And after losing a job last year, I don't have as much health insurance. These programs have made an absolute positive difference.
Connecting community members to the programs and services offered through a community nutrition hub is key to creating a lasting impact. By collecting, utilizing, and sharing data and information, park and recreation professionals can become more effective meeting community members where they are.
I think the city of Asheville really has an opportunity to look at wellness, not just from a movement standard, but we're also starting to look at nutrition and health and how can that stand the test of time within our centers.
We've been trying to target and make sure that we get the voices of all the communities and not just half of the communities or just individuals.
So the 5 target groups were created when we were looking at doing the needs assessment survey.
And with those 5, we feel like we can get the voices of what makes Asheville so diverse.
And when we originally put the survey together, we were talking to our cross-sector project team, the equity department, to see how can we get out this survey out to the community to get the feedback that we need for the communities that are most in need of food resources.
I think the biggest thing about a survey is that that's where you start. You have to gather the data. If you don't have the data, you have no clue where to begin. And so having that data, understanding what that data tells us, that allows us to put those resources where they're most beneficial.
Before, we would just kind of offer food markets and just have them come up, but most of the produce or most of the food that we have is of what we eat and not necessarily of their culture. So we're wanting to learn more of their culture and how we can help them.
If we have one community that has 4 different food banks, We don't need to go in there with another one. We don't need to set up different markets in that same community because they already have them there. But how do you know that if you don't have that data?
We want to make language not a barrier. And so it's important to us that we have people who speak Spanish and English so that we can answer questions in the language that the community members responsible communicating in.
So it's important to target some of these groups because we try to view things through an equity lens. We want to make sure that everyone is given the right opportunities to be successful.
So we went ahead and asked people what are their needs. So for example, a person said, oh, you know what, we need more food bank. A lot of people were not aware of the distribution dates. So Kerman Wellness Hub came up with a distribution calendar for everybody. We distribute it out to the community members so that they are aware of what is actually going on. So those needs are actually being addressed. We surveyed the community, we got those answers, and we're working on providing those resources to the community.
Community nutrition hubs are integral parts of community health and well-being. By building relationships, spending dedicated time planning and assessing, and celebrating community impact, Parks and Recreation can be a trusted champion to connect every member of the community to essential programs, services and spaces that advance health equity, improve health outcomes, and enhance quality of life.
If we don't listen to them and respond to their needs and input, then we're not going to be as effective as we could be.
If we're offering those services in one place, in one space that's safe for the community, then really that helps us all have healthier communities so that people can thrive in their community and live healthier lives.
If you can help someone to a better life, give them a little bit of health services, and in this case also food and nutrition, I mean, it's unbelievable.
I think that the generational impact of a community health hub is long-lasting. It is a generational change. When you can infuse in a child or a teen the need for healthy, nutritious food, that it is accessible, that it is possible, that you can make delicious food, that will carry on for generations to come. This program creates a space and a skill set and an education and a safety for us to really create that generational knowledge that I think will carry with them for years and years to come.